Hey guys, in this video today we are going to discuss elderly people when they fall. What happens, what treatments there may be, how you can prevent it. I am not a doctor. This is not medical advice. If you or someone you know and love needs a doctor because they've fallen, call the doctor, okay? So right here, I got my notes right here next to me. I'm looking at them next to the camera, and we're going to start right here. Okay, elderly people are more likely to slip and fall due to a number of factors. Okay, a number. It's not just one or two. There's a myriad of factors. Okay, it says decreased flexibility. Older people may have a harder time recovering from a slip and avoiding a fall. Okay, so they have a more difficult time recovering because they're older, their bones may be more brittle, even if they're getting all the calcium in the world, okay? And trying to avoid a fall because, you know, their senses aren't as sharp at 80 or 90 when they were at 30 and 40, right? We all can agree with that, okay? Brittle bones. Older people have a higher risk of fractures and other serious injuries if they fall due to brittle bones. So if you know that your loved one has brittle bones or they have some kind of type of arthritis thing going on or something else that may affect their bones, you want to reach out to their doctor, assisted living, nursing home, facility staff, all that stuff. You want to reach out to everybody and get a plan in place that can help protect you or your loved one, okay? That's very important. You have to do that. Vision loss. Vision loss is a risk factor for falls, but it can be difficult to notice because the process is gradual. So, always make sure your loved one or yourself have your eyes examined whenever the doctor says. If the doctor wants you to come back every year, wants mom and dad, grandma, grandpa to come back every year, or your sibling, if you're old, and they want your sibling to come back every year to have their eyes examined, make sure they keep their appointment. Now, a lot of times in some of these nursing homes and assisted livings across America, and maybe other countries where you live, the eye doctor can come out there with a team and some equipment. They bring a truck, they bring some machines and things like that, and they can examine your eyes right there. So if that's an option and you get a thorough, prompt, up-to-date, state-of-the-art eye exam, do it. Check your eyes. Also, check your ears. Make sure there's nothing going on with your ears. Check your otolaryngologist. Ears, nose, throat doctor. Make sure everything's going on good there. So there's nothing regarding to balance, right? Eustachian tubes. Again, I'm not a doctor, but we have eustachian tubes, right? Some people suffer from, I'm one of them, eustachian tube dysfunction. Sometimes the tube clogs up due to allergies or infection or whatever. Make sure you see your doctor, your otolaryngologist, your primary care doctor on a regular basis and do whatever you need to do to get everything in your ears, nose, and throat to be working so your balance is fine, so your eyes are fine, okay? Medications. Some medications can cause drowsiness, loss of balance, and other side effects that increase the risk of falls. So, if your loved one is in a facility or at home, all these things that we just talked about so far apply to wherever you or your loved one are, okay? Wherever they are, whatever the medications are that they're taking, wherever you're living or your loved one is living, your friend, whoever it is, check the side effects of the medication. Is loss of balance one of them? Have a conversation with the doctor. Let the doctor know your concerns. You might even ask the doctor if it's okay to speak to the pharmacist where you have the prescription filled, because the pharmacist will know a lot about the medications and may have some ideas on also how to reduce the risks of side effects, things like that. Get everybody involved. Get as much information as you can. You don't know. Even if you are a doctor, not every doctor doesn't know everything about everything, right? And they have to remind one another too, right? So learn, ask questions is the best way to protect yourself. Okay? Anxiety and fear. Older adults may be afraid of falling and worried about the consequences. Now, let's say that's, the case where, your loved one or you or wherever you are, nobody wants to fall. We all have some anxiety or fear about falling because we don't want to bang our head, we don't want to break our knee, we don't want to do something to our hip or our foot, break an elbow. You get the picture. So if fear and an anxiety is part of, your loved ones, if they're in a nursing home or assisted living, or you are, if that's part of the equation, have a conversation with a social worker or maybe a psychologist and explain what your fears are. Is it a rational fear or is it irrational? Do you just automatically think you're going to fall? Well, maybe you don't have a balance issue. Maybe your feet are fine. Maybe your vision's fine. So there's really nothing to worry about. But if you got some realistic, validated concerns, speak to somebody who can help you even further and reassure you, that you'll be safe when you're walking the halls of wherever it is you are, okay? Because nobody wants anyone to fall, okay? Now, my mom, when she was alive, she had some osteoporosis in her hips and her legs and her feet. And, she didn't really fall on the carpet so much as when she was out with the walker or she was in the hallway and holding onto the rail or the canes. Canes, she wasn't that great at handling. She would hold the cane and just go like, she was much better with the walker because the cane, she was just like, it was like a walking stick, more like a luxury stick, She wasn't really truly using it for its intended purpose. And maybe she didn't understand with dementia, And a lot of people are like that. They get the cane and they just kind of like high class strutting through London, Hey, this is my walking stick, But that's really not the reason. We want our loved ones to understand that cane is to help you support yourself. You're not a movie star walking through Hollywood. That's to help you stay safe, okay? So that's sometimes what we had to do with my mother is I had to get her certain shoes, and also make sure the shoes are on tightly, snug. Make sure that your loved one's shoes fit them. If you're not sure, ask the nurse at the home or the doctor, wherever. Do these shoes fit? Tie them up, put them on, grandma, mom, dad, whoever it is, and make sure they fit. Now, if they're having problems due to maybe obesity or something else, or their balance issue, or maybe they just, when they bend over to put their feet on or something like that, or lift their leg up to rest it on their knee, or put their shoes on, tie their shoes, whatever. If they can't do that, try to get strong, secure Velcro straps on the shoes and sneakers, because they just open it up, put their foot in, go like this, seal it, nice and secure. Now, my mother did that for a number of years because I always bought her the same slippers. They had heavy duty tread on the bottom. They were thick all the way through. They supported her all the way through. She had flat feet. They kind of leaned in, but they lifted it up a little. They were good, and they were all furry, and warm and snuggly and cozy inside. She loved them. And every 4 months, 5 months, when they got real dirty and stuff, I'd have another pair. I'd go in there, I'd throw those away, clean up her feet, and put on a brand new pair. Keep them by her, and I'd write her name on it. So always write your loved one's name on anything in a nursing home or assisted living, or even a hospital. Write their name on it, put a sticker on it, whatever. If you can get blank stickers and just write their name on it in the room they're at and put it on the hospital. Sometimes things go missing. You know what I'm saying? Okay, so let's see what else we have here. Uh, Lower body weakness can contribute to the elderly falling. And when elderly fall, they hit hard. And if they're thin and frail, bones and organs can move around, hit each other, whatever. Again, I'm not a doctor, but this is what I've been told. And it causes pain and injuries. And I think that falling for the elderly could be one of the top 3 reasons why many elderly die. So we want to be really very sure. Is anyone going to live forever? No. But you want your loved one or yourself to live as long as you possibly can and prevent any injuries so you don't have to end up in the hospital, don't have to end up taking more medications and things like that, or surgeries, okay? Vitamin D deficiency, that is not enough vitamin D in your body. So be sure your loved one is up to date with all their vitamin D requirements. That's another conversation for the doctor, okay? Difficulties with walking and balance. Again, do they have something going on with the ears, nose, throat issue, or is it their feet or their eyes, or a combination? What's going on, and how can it be repaired? How can it be helped? Some people require help in and out of bed, in and out of the wheelchair, but once that's taken care of, they can go into the shower because they got the help from the aide, or or a nurse, or even sometimes the doctors help out. The doctors are very busy, but I've seen doctors lend a hand doing a lot of things. Way to go, doctors. And excuse me. So people that are in the wheelchair, once they get the help, they have fun. They go to the cookouts, they watch the movies, they play games, they socialize. They just might need help getting out of the wheelchair into the bed, from the bed to the wheelchair to the shower, blah 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 blah, onto the toilet, so they don't fall because they have a balance issue in one or many places, or whatever it may be. Right? Some people may have very weak feet or no feet, so they need help. But once they're secure in the chair, they can live a full life to the best they can. Okay? So think about that, guys. Vision problems, whatever. Make sure whoever it is, your loved one, has the correct contact lenses, glasses. These are new glasses for me. They're trifocals. 1 prescription, 2 prescriptions, 3 prescriptions. And it's taken me time to get used to them. So make sure your loved one has the prescription contact lenses, glasses they need. Okay? Home health hazards or dangers such as broken or uneven steps. Want to take care of that. If you have broken or uneven steps, or carpet on the stairs that is loose, you either want to nail it down or take them off. And get sand and gravel and dust and things like that can be a slip hazard. You want to clean that off, keep that off. Okay? Throw rugs or clutter that can't be. I'm sorry, I can't read this. Throw rugs or clutter that can be tripped over. Throw away, it's supposed to be. Okay? Excuse me there. So anything that's clutter, from one room to another, if there's any kind of clutter, if you're at home or in a nursing home, clear it out, have a nice clear path. If your loved one at home or wherever they may be, or you, wherever you may be, you want a clear path. They get from the bed to the bathroom, to the kitchen, back to the bed, to the living room, whatever. You don't want anything in the way. You want a nice clear path. Okay, so let me see what else I have here for you guys. Again, make sure all footwear fits snugly. Trim loose or ripped pants. Now, sometimes my mother, she would wear those pajama pants, right? And they would tear on the bottom. And as she was walking, there was like 4 or 5 inches hanging off to the side. And sometimes she would step on it. Now, I noticed a number of times I would have to go in there and cut that off. And then it fit fine, but it was a little uneven on one side because half part of it was missing, but she wasn't going to trip over it. So that was good. And then if it ripped more, I just threw it away and bought her more. Okay, what else? Check the canes. Check your cane and check your stroller, or your loved one's cane or strollers. Make sure that they're tight. Make sure that they're sturdy. Make sure they're not falling apart at the bottom bottom, or the handle is loose. Make sure everything's good. If the walker has tennis balls on it, make sure that the tennis balls are fine and even and on there, supported well and firmly. And you want nice sturdy walker to walk with. If it's leaning back and forth or something like that, that can cause a balance issue with some people and they could fall over. So always address the issues with the nurse and the doctor if some of the equipment isn't working properly, or the physical therapy or something like that, so they can work with you to replace that equipment or fix it. Maybe it just needs a new part and it's as good as new. So look out for that, okay, guys? Okay, falling on floors, there's cement floors, there's tile floors, there's gravel floors, there's all these things. You want to be careful. If you live at home, your loved one lives at home, make sure that they have one of those buttons. So if they fall, they can hit that button. Now my dad had it around his neck. It was good, just a short little thing. So so it was always right there. And he also had one on his wrist like a watch. Those are very good. They help a lot of people. I know, because I can't tell you how many times the fire department or the police department calls, says, hey, Dad took another fall. Dad took another spill. Up to the apartment, Okay. Notify, if they don't already know, notify the staff wherever your loved one is or wherever you are if there's any trouble walking. If somebody says, hey, my feet feel weak or my legs feel weak, or you're saying it, make sure you say it not only to your people visiting, but to the staff wherever you are, so they can get on board and help, okay? Okay, so 17 minutes, trying to keep this short, guys. Just declutter the home, declutter the nursing homes, reach out for help wherever you can. Falls can be life-threatening. Now, when my mom was in a nursing home, there were some people that I know that had falls and they died. These people were already in their 90s and they were walking around, they were exercising, they were doing everything, but they fell and they hit the floor hard. And sometimes it's a carpeted floor, sometimes it's a tile floor. And within a few weeks, they were dead. Now, would they have died if they didn't fall? I don't know, but I'm saying try to do everything you can to reduce falls. Okay, guys, and just speak up. You have the right to advocate for yourself or anyone else. I'm not a I'm not a lawyer. This isn't legal advice. So if you need legal advice, contact a lawyer. Boy, I make so much mistakes. I think it's the caffeine. I'm sorry about that. So speak up. Speak nicely, get the point across, take care of yourself or the loved ones that you're trying to take care of, okay? So guys, you take care. I'll see you in the next video. Everything that you're doing is well and awesome, and be a caregiver warrior for life.